let's go ahead and get started. I want to be very respectful of folks' time. I think we promised everybody an hour of content, and as close to an hour of content is what we're going to be giving them. So first and foremost, I want to thank everyone that is joining us on Zoom today. We're here to have a super conversation with some experts, and today we're going to be discussing eliminating data silos to unlock savings and enhance the member experience. We have some esteemed panelists with us today. I will be hosting our conversation. My name is Rick Christensen. I'm currently the Director of Market Development for Innovaccer, the host of this program. And I am joined by Anil Jain, who is currently our Chief Innovation Officer at Innovaccer, and as a recognized experts on the challenges of EHRs, clinical informatics, data governance, and advanced analytics, and as well as the former Chief Information Officer at IBM Watson Health. I'm also joined by Amy Burke, who is Director of Population Health for the US Health and Life Sciences at Microsoft, who brings us 26 years of healthcare experience, including strategic, operational, and policy consulting on a global level. And then finally, I wrap up the group with Amy Siklai, who is partner and commercial payer leader at Guidehouse. And we're proud to have both Microsoft and Guidehouse here with us as their strategic partners of Innovaccer. And we continue to partner with them to help solve healthcare problems, both nationally and globally. So let's get started, guys. Before we begin, I wanted to give everyone just 5 seconds on who Innovaccer is and why we think that we're in a position to host this program. So at the end of the day, Innovaccer is a platform company, and we pride ourselves on being one of the largest healthcare data platforms in the country. And we are extremely proud that we've become that in a very short amount of time. With our founding in 2014, we already have over 60 customers that we're supporting with their value-based care journey, with 24 million patients currently in our platform and over 60,000 providers using the benefit of the healthcare data insights to optimize care for their patients. We began our humble journey on the provider side of healthcare, and now are proud to work across the continuum with both provider organizations, payer organizations, life science organizations, and a number of others that are both just essentially supporting our mission of bringing the most complete, comprehensive care to patients at the lowest total cost and providing the best possible outcomes. So I would love to give both the Amy's an opportunity to introduce their organizations.
Great, thank you so much, Rick. I really appreciate the opportunity to be here today. And as a steward of Microsoft, I want to just let people know that Microsoft is committed to healthcare. It's our mission to empower every person and every organization on the planet to achieve more. And with that said, that does extend to our healthcare customers, both in the payer and the provider sectors. We have our Microsoft Cloud for Healthcare, and we are a partner to Innovaccer, which I believe is very compelling for many organizations as they advance their healthcare initiatives and their digital transformation as a whole. So thank you for having me, and I look forward to today's discussion.
Thank you for being here.
Thank you. Yes, Guidehouse, we're thrilled to be here. And a little bit about us. We work with payers, providers, both public and commercial. We work around the globe. We're in more than 50 locations. And really what we're here to do is solve for all of the complex problems that we see within the healthcare ecosystem, and really taking a different approach to recognize the importance of value, both to us as consumers of care, as well as the companies and governments that we serve.
Thank you, guys. So let's go ahead and get started. So I wanted to start our conversation off with an agenda, so everyone is prepared for how the flow of this conversation will go. First we're going to start our conversation with the discussion around how data fragmentation is currently impeding value within the healthcare ecosystem. We're going to discuss a little bit about how cloud data platforms can solve these data fragmentation issues. And then we're going to discuss very briefly 3 key objectives to measure data strategy success. And then finally, we'll bring it all home with the opportunity to field some questions from the audience and end with a couple pearls of wisdom that we hope that the participants will take home and use in their day-to-day lives to start defragmentizing and breaking down the data silos within their own organizations. So is everyone cool with that agenda? We're going to go ahead and get started. So we all know how pervasive the problem that data fragmentation is. And, preparing for this conversation, I was struck by the fact that how far we've come, not only as a nation, but how far we've come from healthcare. I was looking at statistics recently that showed, just 20 short years ago, there was less than 20% adoption in the EHR space. And now we're at a point where there's 94+% of healthcare organizations that have adopted this technology. And what it really makes a lot of sense, or creates the foundation for this world, a connected world where we have more data than we've ever had before. I think another statistic that was really compelling to me is a connected person just 12 years ago would be interacting with just 4 to 8 data sources a day. And now, based on the change in that landscape, that same connected person is going to interact with almost 2,400 data sources that are all triangulated around them to try to change their behavior, either as a consumer, dictate their care as a patient, and generally influence their lives. One of the things that we know most is that healthcare data fragmentation impedes value across the healthcare ecosystem. And in a recent survey done by Innovaccer, we found 2 areas that organizations were struggling with in increasing amounts, both prior authorization and denial prevention. We know that these are just 2 of dozens of different areas that represent fragmentation in healthcare. We'd love to get the audience's both take on this information and insights from your personal experiences. Dr. Jain?
Yeah, sure. I mean, I think it's not a surprise to any of us that data fragmentation exists. We don't have a single healthcare system, if you will. We have a bit of a cottage industry, and different folks who have different intentions and who have different business cases and business models sort of tend to create their own data sets. But this fragmentation, this data fragmentation, is really a unrecognized tax on any kind of innovation that we would want to do in the market. And it's not just that we can't seem to have interoperable data, but that they seem to be living in different systems. Many of the organizations have acquired different parts and pieces of technology over many years, and there are legitimate reasons why that data might be fragmented and siloed in many ways. And then there are some illegitimate reasons where there's perceptions of regulatory requirements or perceptions that it's hard. Of course, healthcare data is hard. But that fragmentation, I think, leads to not just the 2 aspects of what you're describing here, where we struggle with things that we ought to struggle with. Prior authorization, where the data exists in the system, the rules are fairly clear, and yet we still tend to bug the doc, bug the payer, most importantly, the patient or the member, to get information that already exists. And you made a great point, Rick, earlier, where you talked a little bit about how we had 20% adoption in EHRs 20 years back, and now we have 85% plus, or maybe even 95% plus in some markets. The problem is that's all that is just simply data. It's not necessarily insights. It's not necessarily actionable information. And so as you start to think about some of these data fragmentation, it's important to recognize that it's not simply about connecting data together. It's about connecting it in such a way that we actually drive insights into the market that will address things like prior auth, things like preventing needed services from being denied. That is a friction and a barrier for efficiency in our healthcare systems and among the payers and providers who are working together. So I'll pause there, but I think we shouldn't be surprised by this. and how we approach this data fragmentation challenge is going to make a big difference between whether we have another 20 years of kicking the can down the road, or we're really trying to get at the root advantages, being able to break down these silos, start to connect data in a sensible, regulatorily compliant manner, so that it drives value to the members, the patients, to the providers, and the plans, and builds trust all at the same time.
Amy Burke, I would imagine as folks go looking for a cloud partner, right? They've pretty well identified their problems and where there are opportunities in data fragmentation. Can you give us some insights from your experience? What is the initial conversation with a potential client like, and are these operational issues that are driving or that are being driven by data fragmentation consistent with what you're hearing from your clients?
Yeah, thank you for that question. Just to tag on to what Dr. Jane had mentioned already, I think, data is fragmented, and there's an opportunity in how we manage our members and plans, right? And I think that's a good place to start, because the member is at the heart of the health plan, and it's the health plan's responsibility to be managing for better outcomes and improved experiences for our members as a whole. The data that is collected on these members, should be insightful. It comes from various sources, right? So we need not just consider clinical data, but we have to consider behavioral health data and social determinants data as we think about how we intervene with our members today for a more holistic way in which we deliver care and for those improved outcomes in all components of somebody's health. With that said, though, I'd like to also consider, going back to a point that Dr. Jane had mentioned about the fragmentation of data, it reverts back to members as well, in that members today are extremely savvy in the way in which they navigate through the healthcare system, right? They have choice today. They are going from plan to plan or from provider to provider. So meeting members, patients where they are in the continuum, I think also really begs the question of why we need to consider more cohesive data structures for delivery of care for our patients and members in the spectrum of healthcare.
Oh, that's such a great point. I think when we're looking at data integration, we so often forget about the data that can't be seen. How often patients are slipping outside of network purview and visualization of all the stakeholders, but how much of that activity quite frankly, creates data points that can be actionable or meaningful when it comes to a patient's journey. Amy, I know that you guys have so much experience guiding organizations, with these sorts of challenges. Anything to add from a Guidehouse perspective?
Yeah, and I think that to kind of build on what was said before, and relative to, in particular, that fragmentation, right? And recognizing that there are so many disparate data sources that are being ingested and fed by, whether it's a payer, a provider, even that member. There are so many entry and exit points. And with all of these disparate data sources, you almost end up with multiple sources of truth, if you will. And so consequently, it's very difficult, and it creates an enormous amount of both abrasion within that system as well as waste, and recognizing whether it's determining clinical workflow, whether it's determining how to engage with a member or a patient, how to make better decisions as a payer relative to your product design, for example. All of those different fragmented sources of data have a huge drag on both the ability to perform as well as the ability to really deliver good quality care at a lower cost point.
Makes a lot of sense. I think everything that we're talking about is commonsensical, right? But the reality is, in healthcare, is what common sense is not what's common practice. And, it doesn't often make intuitive sense to me why so many of these silos exist, right? We know that the volume of healthcare data is growing at an exponential rate that most industry stakeholders can barely keep up. We know that the fragmentation of that data and lack of transparency in that data creates inherent trust issues between all the parties that are forced to partner together to solve healthcare's problems. And then we also know that data is a new acumen in healthcare, and it takes a lot of time and resources. And those resources aren't always readily available. They're not always easy to find. And it's sometimes hard to get the buy-in organizationally to apply those resources to this problem. And when you get that buy-in, it's hard to even define the type of resources that are necessary. I'd love for folks to respond to some of the statistics on here. Amy, talk a little bit about, different data silos that you're currently seeing as folks approach you, and more importantly, where are you seeing challenges in interoperability and different data structures that cloud infrastructures can help support?
Sure, and I think it goes back. Oh,
Go
go
ahead,
ahead, Amy.
No.
In the future, I have to be very explicit. I forgot that we're dealing
Exactly.
with Amy. I forgot we're dealing with Amy's. So my apologies. Whoever feels most appropriate can answer, and then I'll be much more explicit in the future.
No. Well, I'll lead us off, and then certainly hand it over to the other Amy. But no, I think it goes back to, again, is just the sheer magnitude of data that is exponentially increasing day over day. And given so many of the disparate sources, what is that single source of truth? And that does create some friction relative to a trust, right? Is this the appropriate data? Is it meaningful? Is it actionable? Because again, of the sheer volume of it, the time and the labor intensity in order to make it meaningful and actionable in any real semblance of real time. That is still what we see as a number one drag, is how do I get the information and what can I do with it? Is it still relevant?
Mm-hmm. Amy?
And I think, thank you. I think that too is where the cloud platform can be very instrumental in how we harness that data for usage, right? And it being, data being able to be exposed and surfaced in real time, being able then to use that data to make key decisions, informed decisions on how we do intervene with our patients. But I'd like to go back to the point, Rick, you had mentioned about, the acumen that's required of our providers to use the data, to understand the data, right, to lend meaning to it. And I think that's an upskill for our providers as a whole, for physicians and nurses both. I was a former director of clinical ops at a health plan, and, are our nurses equipped to really understand the data? That's something that we have to sit down and have a conversation about with our nurses, with our providers, and build some governance around that, build some policies and procedures. So there is a plan of action in terms of the understanding of the data. Once, how do we use this data? When do we use this data, et cetera? So it doesn't just stop with the essence that, oh, we've got all this data. Now, what do we do with it, right? So I think that's really important to consider. But certainly the cloud enables for that data to be surfaced in real time. And that's very powerful, especially when you are interacting with your patient member populations as a provider.
I love that word that you used, upskill. And admittedly, I think that upskill is necessary even beyond clinicians, right? To the administrators as well. I think the amount of credit hours I took in my MHA program 15 years ago that focused on data informatics, this much. If you go to the same MHA program now, what percentage of that content is focused on data informatics, right? And so, I think the world is changing and the academic support system is changing. And I think it's imperative for all of us to upskill. Dr. Jane, one of the statistics that I find most compelling on here is the lack of trust. Right? My payer background is working in provider collaboration and really helping providers maximize their opportunities through their value-based contracts. And, seeing this data point, 33, nearly a third of providers, and I would imagine this is perception a little bit based. And if they really dug deep, maybe there's a little bit more communication going on than they really rated. But how do you respond to this? And, how do we as an industry get over this hump? Because this is a woefully inadequate number, and we're never going to be able to succeed with 30% of the provider community not interacting with their payer partners.
Yeah, I think it goes to having an aligned goal about doing what's best for the member and patient. And some of the most successful models are some of the value-based care initiatives where there is a business case for why one would want to share at least insights, if not raw data. But going back to why silos exist, and I'll come back to the trust equation in a second. Part of it is that there is a asynchronous nature of these different silos. So if you take, for example, claims data, you're looking in the rearview mirror about what's happened with the patient. And as you start to look at clinical data from an EMR, you're looking prospectively, what is Dr. Jane doing with this patient, or what is happening right now with this patient? And oftentimes they're not synchronous. Not oftentimes, almost never are they synchronous. They eventually will catch up if we're lucky. And so part of that trust issue is that each side is working from a different side of the same coin, but the two sides of the same coin are in two different time periods, if you will. And so part of creating that trust is going back to something that Amy shared earlier about that single source of truth. We need to be able to bring data together to create a single view of the patient where the payer can say, yep, that is what we're seeing and what we're interested in understanding about a member. And the provider can say what the contributions the payer is making to this, to the understanding of the patient is incredibly important, because if some care has happened outside the four walls of my clinic, I need to know about it as a clinician. So part of the trust has to revolve around the transparency of how information is brought together with a common interest, and the recognition that both the provider and the payer are not necessarily working against each other in most cases. They're just working with a different set of parameters and perhaps a different business case that can come together in doing what's best for the patient and member when you're in these risk-sharing arrangements and these value-based care contracts, and really getting to that. Now, the most fundamental thing is that we're not going to solve this on this webinar. But the most fundamental thing is the way healthcare is organized right now is always going to create a little bit of distance and trust issues between provider and payer, because what motivates their business models is going to be a little different. But we can certainly improve the number from 32% to something a little better by just simply creating a single source of truth, something where both sides feel that they're able to access whenever they'd like, such as a cloud-based strategy. And I think the other thing that's really important is to recognize that no one, not providers, not payers, are expecting perfection. They just want a little bit more understanding of the folks that they're accountable to, the members and the patients. And some of that may be crawl, walk, run, as we have a common set of goals.
Great point. I wanted to take a moment to respond to some comments that we're getting in from the participants. Josh Stevens was looking at one of the statistics and asked, gosh, who the heck are the 51% of organizations that aren't currently struggling with data integration? I think that's a pretty good question, because I think if we're all honest, the vast majority, nearly 100%, are having some structural issues with overcoming data silos. But you know what? I'd love to get even more feedback from the field. And so we wanted to make sure that this wasn't just didactic, but wasn't an experiential learning event as well. So we'd love to push out a poll to the audience and see how what other folks are currently responding with. So what we'd love folks to do is kind of respond to, what is your organization's biggest challenge around unifying member data? Is it the complex regulatory standards for data exchange that are ever evolving? Is it the lack of expertise or skill set to handle that data within your organization? Maybe it's the need for manual data scrubbing from multiple sources and the lack of interoperability, or your minimal confidence in quality of that data that you finally got your hands on. maybe it's managing and maintaining multiple point solutions, and trying to figure out how an enterprise data platform bridges all those point solutions together. So really looking forward. We'll give folks maybe 2 seconds to respond, and I'm actually going to put my answer in here as well.
I don't think you can. I tried to as
Oh,
well.
no.
It says,
I
we
know,
can't
I was
vote.
excited. I was excited. So we'll wait for those answers to come in. I wonder if we have a little bit of data silos going on ourselves with the way that we're collecting the survey information. So let's go ahead and get moving. You know, I anticipate that we will, here we go, guys. Perfect. So let's go through this really quickly. So it seems like the most popular answer, you know, folks, at least in this group, the biggest challenge that they have around, oh no, we lost it. Unifying was managing and maintaining multiple point solutions, right? Which essentially makes sense. You know, think about the typical payer journey. Many of them started very humbly and had growth trajectories that either had them partnering, acquiring, or in other ways, becoming new organizations. And oftentimes that growth is built upon legacy data system after legacy data system after legacy data system. And then here come the vendors, hundreds, if not thousands of point solutions, all aimed at solving your most burning, pressing problem. But what we're now realizing as an industry, that those thousands of point solutions, if not well integrated into a comprehensive data platform, really never materialize and meet the vision statements that they were created to address. What I also find really interesting is the need for manual data scrubbing from multiple sources. And I think in some ways, you know, that really ties directly to the lack of expertise and skill set. Because at the end of the day, if you don't have the folks that have the ability to scrub that data, it sits there and is never truly realized. You know, one of the things that I find really interesting is if you look at healthcare trajectory, I think 20 years ago, everyone just wanted data, right? Just give me more data. I know it's out there, give it to me. Then folks got the data. I just need to know what this data means. Please, please give me insights. Then folks get the insights. I can't manage these insights. Don't you know I have 7 million patients? You need to help use machine learning and artificial intelligence to create workflows within, you know, my patient experience that automate a lot of these insights. And so I think it's really interesting as we grow to watch the needs of the industry change and those challenges change as we look at them in respect to data silos. So we know data silos are a roadblock, and one of the biggest things that they roadblock is our ability to have a 360-degree view of our members, right? We know payers are moving increasingly to a member-centric framework, and a lot of that is being driven by consumerism. A lot of it is also being driven by the pervasive growth of Medicare Advantage and the reality that folks have increasing choice in a marketplace that they didn't have before. The addition of ACA also contributed to that consumerism and choice that truly forces payers to address these issues in different ways. But let's talk a little bit more about what in particular it means from moving from siloed to seamless, and what it means to implement a process that both takes advantage of a cloud infrastructure, but also brings the framework of a unified data model to that cloud infrastructure to truly build the best experience for a member. Dr. Jane, I know that you're truly passionate about this kind of flywheel. I know, this is the reason that you got into the game. I would love for you to kind of give some insights on what you see here and where you think the opportunities are for the audience.
Yeah, I mean, I think this is a great depiction because it actually kind of illustrates some of the silos that we all deal with, right? If you put the member right in the center of all the different stakeholders that touch the member, from the variety of services they provide, the care, all the touch points that even the digital health apps that members are beginning to use, the wearable technologies. There's a lot, and you mentioned 2,400 places in which I think what I jotted down here was that there's people are connected to 2,400
connection points.
Yeah, and that's pretty daunting for a member to be inundated by that. I hope that's an annual number and not a daily number, because that's pretty significant. But the point is that there's a lot of folks involved in keeping a member reasonably healthy and getting and directing them to how they best consume their care. And at the same time, what we know is that their data is coming from all over the place, and we don't have a common patient member identifier across the US. We're not even allowed to have a common patient identifier across the US. So we have to think through, how do we bring all this data that's coming at us, all that was collected for a slightly different purpose, all this disparate data, how do we bring it in so we know whose data belongs to which patient record, for example, or a member record? And then how do we decipher some of the proprietary nomenclatures or terminologies, or if we're lucky, maybe they're standardized terminologies, but how do we make sure that it's right? And then, of course, the most important thing is, how do we bring it together in a way that handles some of the conflicting information that might be present? A payer may have asked on an HRA, do you have any family history of colon cancer? And the member might have said no, because at the time they weren't aware of any. Then you have the clinical record where that same question is being asked by a nurse or by a physician, and they're saying, yes, my Uncle Joe had colon cancer, and he's doing fine now, but he had colon cancer when he was 40. Those conflicting information, because healthcare is complicated, and members and patients, they're not necessarily going to be infallible, and when it comes to their understanding of health and healthcare, we're supposed to be the experts, not them. So having a platform approach where those rules and the governance around the data, the lineage of the data, the provenance of the data, and thinking through, where do you land all this information in a way that downstream we can start to draw out insights from this 360-degree view of the member, I think is really, really important. It's the recognition that there are many, many folks who are involved in creating data, including people like myself and my peers who are clinicians, who at the end of a busy day, I will tell you, aren't going to be collecting as of high quality data or as accurate of data in the electronic health record as they would if they were in the early part of their day. It's just human nature. And so how do we rectify some of those challenges with the quality of the data in a way that when we create this 360 view, we have a set of transparent rules that the payers can trust, that the providers can trust, and most importantly, that the patient and member who are increasingly getting visibility into what care they're getting through their patient health records or through their digital health apps, how are they going to trust this entire process? So I think it's incredibly important to think through and recognize that there are many, many, many producers of data for an individual and many, many consumers, and we need to bring them together on a common platform.
Dr.
And that data model, by the way, is what ties everything together.
I love that example, because in healthcare, there really is a difference between perception, knowledge, and truth, right? And I may perceive something. I may actually think I don't have a previous history with something. But the reality is that perception or knowledge doesn't change the fact that if my grandfather died of colon cancer, that's the fact. And whether I knew it or perceived something different, it doesn't change the fact. And where does that data governance come? And at what point does the fact override the perception or knowledge that may exist with the patient? Amy Burke, I'm struck by this, right? Like, let's be honest, folks like Microsoft Azure's cloud data platform, you make up one of the biggest, most influential portions of this diagram. Talk to me a little bit about where you sit in this journey and, what it is like to sit upstream from a unified data model like Innovaccer, and kind of where you see the world in terms of cloud data platforms and how they contribute to this unified data model.
Yeah, I think, thank you for that question. The cloud data model is certainly going to enable scalability and flexibility with our data. I think that's extremely important as we think about growth of our health plans that are out there today. We're seeing many health plans even diversifying their portfolios and coming on to take on provider, like that notion or that term of payvider exists. So as data, that's another source of data. So being able to, extrapolate data from those various sources, being able then to aggregate it and integrate it into meaningful action, as we have been talking about in this webinar thus far, is going to be very powerful and only going to keep growing. And I believe too, one thing that hasn't been talked about a lot yet is, you mentioned the upstream and then there's the downstream, right? So as we think about, we use this data, we harness data from various sources, we use it to make meaningful decisions. We then have to evaluate on those outcomes, right? So how is it that we then use data to surface for visibility of outcomes, evaluating operational, financial, and clinical performance, being able then to really segment that data individually in terms of financial, operational, and clinical, as I mentioned, but also being able to merge that data where it makes sense so we can really evaluate outcomes more meaningful and then act on those, right, insights in what we've learned. So I just think that's where we should be focused on, and really being able to resonate the notion that the cloud enables for that scalability and flexibility that we need with data today.
I'm so glad that you mentioned the financial piece, because so often when we think about healthcare data, we forget the burden that cost plays in the ecosystem, particularly when it comes to data for whatever instance. And the ability to directly see not only the cost, but in some instances, the price of services and the impact of provider behavior change on different value-based contract methodologies and revenue opportunities, I think is something that cannot be overlooked. Amy Siklai, like, as you're looking at all the disparate data sources on the left-hand side, I know that Guidehouse has a lot of experience trying to leading folks to water when it comes to these strategies. Where do you feel that folks have it figured out the most, and where are some of the data points or data sources that you think that, industry partners that you're seeing need to have the most attention?
Well, as Amy mentioned, the concept of payvider, which actually we at Guidehouse coined and have really, are addressing in the market, and that you have to Amy's point, payers who are acquiring providers who are looking to really dictate the model of care delivery, which in some cases is really anathema to the delivery of care itself, where you have providers certainly looking to become payers and manage risk in very different ways than they have before. And effectively, the same infrastructure, if you will, technology, bells and whistles that a payer needs, a provider needs ever more as well. And really the inverse is true, but the cost of that infrastructure, the cost of managing that data, both in terms of time and treasure, without a consolidated, effectively cloud platform that enables that interoperability, where that cost, one, can really almost be spread, if you will, or shared across entities, as well as enabling far more transparent data. And with that transparency of data also really shines a light on the inherent costs, both within the system from a payer perspective, as well as that from a provider and the delivery of care. And if you think about it as well, from that member perspective, unfortunately, unforeseen medical costs are the #1 reason people in this country still declare bankruptcy. And if we can help to shine a light on creating care, at lower cost with improved outcomes, really driving better outcomes for members, for patients, ultimately, that's what we're here for. And last, I'll say, looking on the left where there are the personal health devices, right? Who doesn't have an Apple Watch or a Fitbit anymore? And there was once a perceived notion that no member, no patient would ever want to be monitored, but we're all doing it ourselves. We all recognize now that a more engaged member or patient is a more adherent member or patient with better outcomes at lower cost. And that is something that I think that we're all beginning to understand the importance of. And really at the heart of that is that interoperability of data that's being shared.
Amen on that.
Rick,
Go
Rick,
ahead.
I was just going to add one comment that Amy reminded me about. She mentioned about how payers are buying provider practices so they can dictate care models. And I don't think she meant it exactly that way. But I think it's really important for us to recognize that most providers, if they're going to change their care models, they're going to want a very data-driven approach to understanding what's really happening. And it can't be just about cost. Cost is important, especially avoidable cost, but it has to be about quality and clinical outcomes. And I think having a data platform is the best chance we have to start to marry up clinical outcomes with actual cost, so that when you have a group of clinicians, whether they're part of the payer group or independent, because clinicians can, despite what we might think, they can be coached into doing the right things for their patients. I think it's really, really important to be able to have a very data-driven conversation. And I think having that breaking down the silos and having a common platform gives us a chance. So those payers who are interested in reforming different care models are able to provide the right kind of data to their clinicians, so the clinicians can decide what is the right care model that they should be applying. But I think that's a really important thing as we think about payers and providers collaborating. It needs to be data-driven, it needs to be trusted, and at the end of the day, the clinicians need to start telling themselves what it is that they need to be doing differently. And I just wanted to point that out because I think yeah.
I think there's 2 points there. I think one of the things that I would love to tag on to what Amy said about this kind of growth of the payvider, I think it's important to understand what's at the philosophical core of each of those organizations, right? Take Pittsburgh, my old market. You have Highmark, which was the largest payer in the region that decided it wanted to get in the provider game. Conversely, you have UPMC, which was the largest provider in the region that maybe didn't want to play nice with Highmark anymore and decided that they wanted to get in the payer space. But if you go back to their core philosophically, one started as a provider org and one started as a payer org. And how does that influence the way that they approach the same problems, either similarly or differently? And one of the other things, Dr. Jane, I think is so relevant to what you said from my experience there was transparency, right? What I've found is, the vast majority of primary care physicians have no indication the cost of the services that they're currently providing. And what's interesting about that is they know way more than the specialists do, because the primary care physicians have been brought along this value-based care journey for a couple years now, and the specialists are just getting into the bundled and other value-based games. And so it's going to be interesting to see how market behavior change just by providing transparency to that information, and for the very first time, giving providers insights into the cost of the services that they're currently providing their patients.
And don't forget, also giving that same information to the members so that they can also be part of that decision-making process.
I think one of the things that often happens when we look at the segmentation of data and breaking down data silos, and in particularly this idea of a data platform that crushes all those silos, is I think sometimes we oversimplify the process of getting that data, ingesting that data, normalizing that data, unifying it, enhancing it, then putting it in a visual representation where it makes sense to folks, then creating actionable insights that drive behavior from it. right? That is a multi-step process that everyone that starts this journey gets punched in the neck with, when they realize, how difficult it is. I would love just the broader group's insights. I know each of you have gone through this journey yourselves within your respective organizations. I know Dr. Jane, you come from very esteemed provider organizations that have gone through this journey. Like, where do you find that folks are struggling the most, with these 6 steps, or even in some cases, the 6 tools that it takes to break down on the silos that currently exist?
Well, I can go first. I think there's another box to the right of visualize, which is act, which is what do you now do with that information. But I think health systems, they've made, and I'll speak from the health system point of view in terms of how they collaborate around this, would be they've spent a lot of time and energy, as well as significant amounts of money acquiring, implementing an electronic health record. And they fully expect to get as much value from that investment as possible. And that many of the steps along this sort of linear fashion somehow should be magically done by the back-end databases. And we know that's somewhat limited. There's also, it goes back to the prior set of conversations we were having, what is the intended purpose? What do we want to achieve at the end of this cycle? And sometimes you don't always know what you're trying to achieve. So every time you have a project, you start from scratch. You re-ingest the same data, you renormalize, you bring it together and unify it, and then you ask another question. There's a inherent taxation that happens each and every time you pull data to answer another question. So, again, in a simplistic way, and love to get the other Amy's perspectives on this, but somehow we got to change the paradigm to saying, let's collect the data, let's clean it up once, let's create a common data set and start asking a whole series of questions in which we can visualize some insight that we can act upon. And then if we need to pivot and make some changes, let's reduce the cycle of being able to do that. And so, I happen to think that we should ingest as much data as we can if we can do it effectively and cost effectively and simply. And then let smart people ask a lot of questions from it, and then keep iterating on that instead of, this cycle of having to go back and get the data and find the right, folks to be able to understand it. It just seems like a lot of waste. And that's what I think health systems are struggling with, is how do they prevent that cycle from repeating itself over and over and over again?
Yeah, and to extend on what Dr. Jane said, the right side of ACT, I also think there's another chevron that exists, is to exchange the data, because this is where optimum care coordination can happen, and facilitate those value-based arrangements that are going to be the mainstay as we go forward in healthcare. So that's my 2 cents.
And it also creates a collaboration on utilizing data that key stakeholders across both payers, providers, even us as patients and members and consumers of care, the ability to collaborate based upon data, based upon what is known, to really be able to create what will be, right? We know that the utilization of retrospective data can inform prospective needs, prospective products within the market, for example. And so that collaboration across really can make change and be instrumental in improving outcomes.
Really great insight. You know what, before we begin, or before we move forward, let's have another poll question. Right now, as the audience looks at their top business priorities for the use of data, we'd love to get some insights as a group, what those are. Is it your ability to predict member outcomes, risk stratification, identification of high-risk populations? Is it reducing the overall cost of care through better insights to clinical data and care models? Is it creating a positive member experience, recognizing the change in the landscape based on consumerism? Or is it improving operational efficiencies, understanding that administrative burden is one of the biggest opportunities to capture margin within a payer organization? Or is it complying with government regulations that seem to be ever increasing, with them becoming a bigger and bigger player in shaping how they think that this world should work with data exchange? So if folks don't mind, we can go ahead and answer those questions, and then we'll wait a second and see what the answers, and hopefully we'll get a little bit more immediate response. We'll wait one more moment for folks to put their answer in. And you know, I hate to leave questions for the very end, particularly when they are so relevant. You know, Katie Freshwater, one of the participants, you know, asked a pretty insightful question, and I'd love to kind of put it out to the group. You know, when it comes to large enterprises, you know, sometimes it's difficult knowing who should own the data platform, its governance, maintaining it. You know, from your insights, where do you think that that most typically occurs? And is that the most appropriate place? And where do you all as panelists feel the most optimal place to have that journey begin or be managed exists?
Well, I think traditionally within a payer, that infrastructure, and recognizing that most payers are an amalgamation of many, so you often have a number of redundant sets of infrastructure or platforms. They've tended to reside within the IT organization. What we do see is across payers that the lines of business, the business stakeholders, are having far more input and say as to, one, their needs, and two, their expectations of really receiving service as part of that organization. So I would say the infrastructure and support certainly within IT, but driving the outcomes and input from stakeholders is increasingly relevant and important.
It's really interesting, Amy, because I find that it really comes down to the maturity of the organizations often, right? Like, are we talking about an organization that's subsetted or subsegmented IT from data? Are we looking at an organization that has even gone as far as subsegmenting digital strategies from data strategies? But I think you're right. One of the most pervasive things is recognizing that there's a myriad of increasing stakeholders that live downstream, to use that term again.
Exactly. And it really goes back. Yes, and it goes back again to that kind of source of truth of data, in that often we call them kind of shadow IT. And, you know, there are many parts of an organization that are ingesting or utilizing data that may or may not be that single source of truth, and utilizing it for a variety of purposes, including managing their business. And, you know, obviously the outcomes aren't optimal when that happens. So the importance of really that centralized data analytic capability that everyone can leverage is far more cost effective as well as effective for the operations.
Dr. Jane, from your experience, who typically had governance over, you know, this initiative, particularly in provider orgs that you've dealt with? I know we're here for a peer conversation, but I'm curious.
Well, I think in general, when you start thinking of platforms and partners and products, and especially if you have a cloud-based solution with a data platform, it becomes less of who owns the platform versus who manages the relationship with the partners and the platform. And the governance needs to happen through a wide contribution from different departments, because the typical IT shops are thinking of governance in a very technical framework, as opposed to the business leaders who are thinking of it in terms of how do I get the most business value from what I can do, and then how do I start to break down some of the silos to be able to start sharing my goals so that you have a multiplying effect of the investments that are made. I think more and more there's going to be less of owning a data platform and owning a relationship with partners and platforms, partners like Microsoft and services from Guidehouse and perhaps a data fabric from or a data platform from Innovator. All those relationships need to be very carefully managed. And otherwise, we as partners can get burned out pretty quick with all the different demands that a client might place. So the IT group should manage that relationship, but they should be getting a lot of input from the whole organization and actually pushing on how they can have a scaling effect from the relationship. Otherwise, moving to the cloud has a very different meaning.
Really good insights. Let's go to this poll question. I don't think any of us are going to be surprised by this answer, right? I mean, we're talking with a payer audience right now. I can tell you the number one thing that I was focused on during my payer journey was lowering the total cost of care while in any way, shape, or form improving outcomes. And what I think is even more interesting to me is when you take reducing overall cost of care and improving operational efficiencies with both mean margin to me from a payer perspective, they make up greater than 60% of the audiences, or nearly 60% of the audience's responses. And so it does seem like payers, at least in this audience, are really mindful of where that money's going and really mindful about where care variability in particular, in my mind, variability in care is the enemy of value-based care. Right. And we never want to get to a point where we take away the art of healthcare from those physicians. But at the same time, by leveraging data, some pretty powerful insights start to come up about the care models that are the most effective from an outcomes perspective. And when you mirror those with the financial information, sometimes some pretty big home runs emerge in terms of, how maybe not all, but a large majority of our patients should be treated. The reality is that breaking down the data silos solves each and every one of these priorities and really helps a payer organization address them in different ways, right? We know that it enables fluidity and scalability. We know that a comprehensive data platform also removes the elusive black box. That's one of the things that we also need to talk about just for a second as you're looking for ways to reduce those data silos and looking for ways for a cloud-based infrastructure to support your data. What level of transparency do you have? And do you have, as an organization, the ability to, quite frankly, see the data infrastructure up close and see how the different pieces that touch one another influence or may conflict with one another? So we know that healthcare, breaking down or a cloud data platform enables both fluidity and scalability. But any responses from you guys on, these three areas where we really have identified kind of the sweet spot for improvement?
The only thing I would add to this, I'll make it really brief, is we don't know what's next what the next big challenge is going to be. When the pandemic hit, we're all struck by having to be very nimble and flexible at the same time. So I think we just are thinking about what can future-proof the investments we're making in data and analytics. One way would be to say, well, how do we do this in a way that allows us to be very, very nimble if another thing should happen or we start to see other technologies take off? How do we very, very quickly pivot our investments to be able to do that? And I think the best bet is when you have a platform in which you're getting insights and you're getting requirements from a whole host of different venues or vantage points that are going to drive that. So I think it's important to think about the future proofing of that as well.
Amy?
Yeah, if I could just say, I think the next frontier with data is how the patient is going to use their data. The self-management of care is so important, and being able to extend that through the ages, right, through the care continuum, I think is going to be very, very interesting and a compelling story as we move forward with data.
I think also that the old on-prem data models that existed before were incredibly capital intensive, and the ability to leverage that data, if you are a smaller payer, for example, if you're participating in value-based arrangements as a payvider, for example, the ability to really leverage and utilize that data, even from an operational perspective, was very expensive. And with the ability to scale with cloud infrastructure, the ability to really utilize it as OpEx versus CapEx, it's really kind of changed the model, if you will, and it's given kind of the little guy a leg up and the ability to create flexibility and scale within their organizations as well, which drives that member, that patient engagement, which drives improved adherence, which brings down total cost. And so I think it's really we recognize that medicine will advance, that technology will advance, the ability to leverage AI and machine learning relative to our infinite amounts of data and what we're able to do with it in far more real time will continue to advance. But that open cloud infrastructure really is the underpinning for that and enables so much of where I think we'll go from here.
Awesome. You know what? I'm looking at the time and I apologize. We're out of it. And I want to be respectful to all the folks that I know that are heading to the next meeting in their very busy days. I did want to let participants know that we plan on continuing the conversation a little bit further and diving deep down into, quite frankly, how to evaluate your strategy. You've started this journey. How are you evaluating whether you are successful and where there are opportunities to improve your approach? And so we really hope to continue this dialogue in future webinars and thank everyone for their participation. But with the end of this time, we're going to go ahead and adjourn. So thank you, everyone, for joining us. And thank you even more to the panelists for all your valuable insights, and to the panelists, quite frankly, panelist organizations for your partnership. Innovacer would not be able to do what we do without Guidehouse and the power of Microsoft behind us. And so we're very grateful. And if anyone would like to learn more about Microsoft's cloud offerings, Guidehouse's consulting services, or Innovacer's approach to a unified data model that is platform first, please do not hesitate to reach out to me, and I'd be more than happy to get you in touch with the appropriate folks. But with that, we'll go ahead and adjourn, and thank you.
Thank you.